All right, two bald men with microphones. What could possibly go wrong? So we're at episode 19, and we are 1 week closer to being pain-free at 100. What's up, Dr.
Damn
Mike?
right. Nothing. Another beautiful day in New York City. I can't even say that without cracking up, because New York City is a bit of a ghost of what it was about 6 months ago. But yeah, I can't complain. I'm alive. I'm kicking. I'm healthy. Got my Chicago Bulls shirt on, so
I see that there.
about that.
Yeah, this was a big week for New York in general, right? There's it's a big sort of memorial week.
That's correct. The 9/11 memorial, and it's a very emotional week for a lot of people, just because everyone that was in New York in 9/11 2001 knew somebody that was affected, in some way, shape, or form. So I grew up in Chicago. I wasn't around here. It was sad. It was a massive tragedy, and it wasn't what New Yorkers actually felt that day. And it wasn't until I moved out, especially to Queens. Long Island was a little bit different, but when I moved out to Queens, it was, you really, really felt it. Like my next door neighbor walked from the financial district back home to Queens, which is like a 10-mile walk, right? The day of 9/11. Showed up his doorstep. Family hadn't heard from him all day, right? Covered in soot and debris. So it's like big fucking deal, right? Huge deal. Not like, oh yeah, it's very sad about those New Yorkers out there, or you're sad for the loss of life. My across the street neighbor was a firefighter, and he was actually trapped under the South Tower for 6 hours with his partner. So it was in the building, was in the third floor. It collapsed, got basically buried by rubble, and 6 hours hanging out there, not knowing if he was going to see his family again. So it hits a bit differently, being in New York than it does normally. And then obviously there's still the hot socioeconomic political environment in the States here. So, you almost felt that tension where it was like, some people wanted to be proud to be New Yorkers and proud to be American and proud to experience this unity. And on the other side of that, it was people that were like, fuck this country, it sucks. So it was an interesting week last week.
It's one of those events that they always say you can remember where you were when it happened. There's not too many of those, I think, in people's lives. That's definitely one for me. I remember exactly where I was when the news started rolling in. And it was on a small sort of old tube TV at the time too. So, we're talking a while ago now. Things were pretty different then. But yeah, there's that. And the other thing that Australians often talk about was when the Sydney Olympics happened, which is in the year 2000. Most people can kind of remember where they were when that happened. And I think the 20-year anniversary for that was this week as well. So yeah, there you go. A little bit of history.
Yeah, I remember getting ready for school and going to school, and the planes crashing in the towers, and then like not understanding what had happened yet, like thinking it was just like, ooh, accident, a plane ran into the World Trade Center. By the time you get to school, it's like, oh shit, this is a bunch of fucking radical terrorists happening there. And then I remember like football practice being canceled and thinking football practice never gets canceled. Like that was my gauge of this is some serious shit. You know what I mean? Because I was in 5th grade, I think. So it's one of those, you don't really possess the scope to understand what's going on. And to me, like the big wake up call was like, oh shit, sports are canceled after class. Like it's usually hell or high water, right? So it was, yeah, it's a sad day in American history. But one of those things where a tragedy like that, the period of time afterwards when pretty much the whole country was united, liberal, conservative, Democrat, Republican, whatever it may be. So you miss that sensation of unity, especially in a very fragmented and difficult time like now. So it's interesting.
Yeah, I think it's one of those things that it's hard to comprehend probably what it means to a lot of people when you're far removed from it. But yeah, certainly, your thoughts go out to everyone affected by it. So this week we've got a new topic. We're going to dive into the idea of ongoing care, because it's a little bit of a controversial topic. the idea of someone being discharged from resolving their issue and being good to go. And then having the conversation about what's next. What is this going to look like in the future? And what's the need for ongoing care to really stay on top of this? There's some different trains of thought about this out there. I've had to change my opinion on it over time. I was very much in the camp of, we get sorted, we're done, we're good, we go on. And I've been challenged on that, and I've had to change that idea to more of a longevity mindset. There's some different ideas out there on this. We've got some strong opinions on it. So, Mike, where do you sit on the topic of longevity care?
Yeah, it's one of those things that I've changed my mind about it too, right? I was in the same boat as you were, where it's like, you're done, you're done. What I found out was, just because you're done doesn't mean you're done. Certain people, certain individuals, based upon their diagnosis, need to stay on top of their care. And that will happen at a varying degree of I guess, time, so to speak. Some people need 4 weeks, some people need 6 weeks, some people need 8 weeks between visits. You can sometimes go 6 months without in between visits, and it's all individual based on the patient. For me, I'm looking at 3 different things. I'm looking at level of structural changes in the actual joint, so arthritis, joint degeneration, cartilage degeneration, joint tears, muscle tears, you name it, right? That's one big thing. Number 2, I'm looking at metabolic and psychological issues. So, are you at a metabolic deficit? Are you at a psychosomatic deficit? Are you a stress case? And the third thing I'm looking at is your activity level, your load. So what are you putting your joint through on a day-to-day basis? Because those 3 things will largely dictate the rate that you reform adhesion. And we want to stay ahead of that adhesion formation, because we don't want it to then cross that symptom threshold, right? We don't want your load to exceed your capacity, if we can kind of go back to episode 1 of the podcast. So looking at those 3 things, that's usually where I make my decision. Looking at, in load in particular, I like to divide it into 2 categories: your load based on your profession and your load based on your recreation. So, you can have 2 individuals that put their shoulder joint through the same amount of load, right? But one does it with CrossFit and one does it because, he's a garbage man, for say. I have a client right now, or a patient, right now, that this applies very well to. So, B-Money, if you're listening to this, I love you. But, right, there's a difference between that, because one is what you do for fun, what you do to maintain your health, but even though, you can do other things to maintain your health well. And one is what puts bread on the table for your family. So I'm going to be more insistent on a more consistent and I guess not wellness package, but longevity package for that individual that's using his shoulder that's just been, repaired from a labrum surgery, more so than the person that wants to do fucking butterfly pull-ups.
Yeah, for me, I actually really just like the terminology of longevity. I actually kind of find the word wellness a bit cringy, to be honest.
Oh yeah, it's been ruined by sleazeball chiropractors for a long time.
Yeah, so I guess if we pick that apart a little bit and just throw up the difference in how we would interpret those 2 words, the idea of longevity is what this is all about. It's the idea of getting the most out of the joints, out of the tissues. We talked last week about respecting the future self because of longevity, because we want to actually arrive at an older age and have our joints being in the best shape possible. And so that's really what we're aiming for with this sort of thing, versus, wellness care, where it's a little bit more, it's a bit less tangible, right? So historically, that's sort of been associated with a long-term care plan to remove subluxations, like chiropractic subluxations. Let's get you in, let's, adjust your joints, make sure your nervous system is optimized. That's kind of been the sale. And that's kind of been debunked for the most part, but it's still a thing. It's still very much out there. So, they're really 2 different things, I guess. they might sort of say that has a longevity component to it, but we'd sort of say, well, show me how.
Yeah, I mean, the evidence isn't clear that long term is going to improve anything. I mean, I guess if you can look at what an adjustment does from a mechanical standpoint and do it at a frequency that's appropriate, at a price point that's appropriate, at a convenience level it's appropriate, or I don't want to say convenience, but I mean, you know, technically if you removed every ounce of adhesion from somebody's lower back and you manipulated them once a week for the rest of their life, the chances of them redeveloping that adhesion would happen at a much slower rate. So I'll kind of put that one on the tee for the adjustment folks out there. That's really where the adjustment shines. I think the adjustment shines as a nervous system modulator. So if you have somebody that develops a lot of neurological tension around the tissues, and that's their biggest area of opportunity in terms of preventing adhesion from reforming, then an adjustment might suffice. I don't find that it really effectively does that as well as people will think. So that's just, you know, my 2 cents on it, and my 2 cents are right.
Yeah, look, I started out really not liking the idea of even just being pushed to kind of rebook a next appointment, right? And it was one of the things that early on I wanted to do differently. I wanted to just let people make their own decisions. I wanted to just have people not feel pressured to, you know, I need to see you here, I need to see you here. Because I didn't like that as a patient. And I think, you know, the feeling that I got sometimes was that it was a sale. It was not necessarily in my best interests. And so that frustrated me, and I just straight out of the gate wanted to change that and do it differently. And I've had to change that, because not coming from a sales perspective, but coming from the best interests of the patient perspective and getting the best result. Because that's the information that we understand. And as a patient, I think, yes, you know your own body, you know, that much more intimately than anyone else will. But you've got to take the advice of someone that's been in the weeds and got the experience with this to get the best result, right? So you might get a treatment, you might feel good, but it's not necessarily done, and that's okay. It's okay if someone says, "Look, I need to see you next week," and probably the week after that, and maybe the week after that. I guess you got to make a judgment call how comfortable you feel with that being sort of salesy at the time. But I think the point that we want to make is that we're only doing that based on the best outcome for the long term.
Yeah, I mean, whatever you've got, whatever your point is going to sell itself. Essentially, if you know what you're talking about, if you're communicating well what you are talking about, and if you have the patient's joint health, you're holding it in the highest regard. I mean, listen, as much as we would love patients to be their own best advocate, and some of them are, some of them really, really are. Some of them, you don't have to tell anything. They're like, when can I come in next? Let's do this. But a vast majority of individuals that come into the office are in the office because they are not their own joint health, right? They're not their own best advocate when it comes to their joint health. And, you know, we're people, we want to develop friendships, we want to develop relationships. But at the end of the day, do I care about somebody's shoulder pain, pocketbook, relationship at home, fucking time, sleep? Which one do I care about more? I fucking care about your shoulder, without a doubt. And again, I'd love to be able to take care of your shoulder and be able to consider all those other things. But I care about your shoulder, right? Because that's my job to care about your shoulder. It's not my job to give you my teat to suckle on. It's not my job to worry about what the finances are at home. It's my job to ensure that the goals that you set out to achieve when you came in, and the goals that I asked you to list out on your intake, get achieved, and they get achieved forever. And, you know, as sub goals, you can do that until you're 100 years old. So, you know, we all have trouble selling at first until you decide to stop selling. And you let what you do sell itself. And that's really where you're going to, you know, both find success as a physician and find success as a patient in any way, shape, or form, right? We're always selling whatever we do, right? Like you're going home and you know, you're closing this podcast and going to work tonight, and you're going to want to come home and have some relations with the missus. You better fucking sell it that it's a good idea for you guys to bump uglies, right? And so if you think about it, like, good idea. Right, it's always a good idea to bump uglies. But if you go about it and you say, listen, babe, I've got an offer for you that you just cannot refuse, you're going to be striking out tonight. If you walk home and your body is selling itself, right? You take your shirt off and you've got fucking rippling abs, and your back looks like a fucking Black Diamond ski course, and you've washed the dishes and you've been assertive and you've displayed your masculinity that day and a little bit of tenderness and whatever it may need, you're getting laid. Right?
It's the like, glistening bald head. I just can't resist.
Well, yeah. I mean, obviously Chris and I have a very easy time you know, convincing our missuses or selling to our lovely ladies that it's, you know, it's about to go down. But at the end of the day, you got to be selling yourself through your communication, through how you're perceived, through your accessibility, right? Through just everything. You sell yourself. You fix people, you sell yourself. You develop trust, you sell yourself. And when I decided that it's just like, I'm going to be so fucking good, right? Got the Chicago Michael Jordan shirt on. I'm going to be so good, and I'm going to be so direct, and I'm going to be so excellent at communicating that I say, this is what's up. I care about your shoulder. Don't give a shit that your wife is pissed off because, you know, your two kids are at home and she's got to babysit them the rest of the day. I empathize for you because I'm a human being, but I've got to put that to the side because I'm professional, right? And there are times in my patient visits where I get unprofessional and I let my personality come out and we have great conversations. But when everything wraps up and I'm summing up that visit at the end of the day, there's a prescription, and you don't argue with the prescription that your physician gives you for metformin or statin or, you know, whatever it is, penicillin. You fucking listen to it.
Yeah, it's just not as common in musculoskeletal conservative healthcare, right? I guess that just, it's sort of accepted in other areas, but it's just less common.
People don't know what the hell they're talking about in musculoskeletal healthcare. No idea, right? Oh, mechanical back pain. Oh, you've got a disc herniation. You threw your back out. Yeah, with a diagnosis like that, and I think we'll be able to fix you. No, who's going to listen to that? You got freaking discogenic pain, L5, wrapping around your hip, down your leg, in your SI joint, and it's going to take this long, and we're going to expect to get this much better, and get your ass on schedule next week, fucking 8 times, and let's get it going. And then you continually prove yourself every visit by then improving that patient. But you've got to know what you're talking about in order to be that affirming and to get to a point where it's like, this is what's wrong. This is how I'm going to fix you. You need to get on this many times. And if you don't want to, it's been a pleasure. There's the door.
Yeah, there's actually research, and I'll probably fuck this up when I talk about it, but there's research that shows that degenerated joints go on to develop more collagen infiltration in the tissues surrounding the joints, which is basically what we're talking about, right? So it's not, it's tangible. It's a thing. I mean, we know that because we kind of see it with our hands more than anything, but that's actually showing up in the research. It's not something that's, it's not a theory. It's not a subluxation, like it's a thing. So,
yeah, it's facts. It's facts.
Right. So, and this happens. So we can clean all that out. We can get all that done. But to some people might have a genetic predisposition maybe to even do that faster than others, but it comes back. So we use our tests, we look at it, we see how's the function. If it's degraded, we clean it out again. That's it. I had a good example of this actually during the week. So my partner works in childcare, so she spends a lot of time on her feet, but also sitting on the floor with the children, that sort of thing. And she's been prone to having a bit of back pain over the years. One huge flare-up years ago that was kind of treated under a more traditional chiropractic model, some adjustments, some kinesio tape, some dry needling. Didn't help a lot, but thankfully we were able to get that under control. Fairly recently, we spent a lot of time actually addressing it again, because when we were kind of in initial coronavirus lockdown, I wanted to keep my skills up. So we spent a lot of time treating that and working through the lower back and the hips. Got it all cleaned up, and everything was really good. And so now we're sort of months down the track again. And she said to me the other day, "Oh, can you take a look at my back? It's feeling it's feeling a little bit crappy again." So we did. We got in there, we measured it, we palpated it. And what I actually found was that she used to develop some adhesion in the left side of the lumbar erectors. That was kind of the main spot that we cleaned up before. That was actually still good, but on the right side, interestingly, was where it had started to palpate a little bit less clean. So we had to get in and work on that. Checked in with her a few days later. She said, "Yeah, I'm feeling really good again." I guess the point is that no one's really immune, right? And it just depends on all sorts of factors, whether that's environmental, metabolic, like you touched on before, exercise exposures, all of these things kind of come into it, but it's going to happen. So yeah, that was interesting for me, I think, just because I had that picture of having cleaned it all out. And so in your head, you're sort of like, okay, cool. Well, won't be dealing with this again for a while, but then bang, it kind of comes up. So it happens.
Yeah. It's anything that causes even micro-inflammation and you're unable to then clear that micro-inflammation out. So you think of an extended posture. You think of, again, like you said, degeneration in a joint. You're going to have an increased prevalence of inflammation through that joint. It's using that joint a lot. It's being overly stressed. It's having hypothyroidism. It's having hyperthyroidism. It's being too heavy relative to your joint structure. It's anything that's going to cause an inflammation and an inability to clear that inflammation out in a timely manner. Because at the end of the day, that's where that collagen basically comes in, is when you can't heal that tissue in a comprehensive manner, and your body says, well, I can just let this thing fucking rip, or we can lay down some thick fibrous tissue for it and live to fight another day. So it's tough. I mean, I've got a guy on right now who's a, fitness influencer basically. And, we've had some difficulties getting him in as, other things in his life are popping up and taking priority, which personally, I think it's a bit ridiculous, because he's using his body every day to make money. So outside the point, but he has a torn hip labrum, femoroacetabular impingement, and he had, his lower back, and not his lower back, his hip was loaded with adhesion. We removed the adhesion. We got him asymptomatic. And I just kept saying, listen, this is what's got to happen. This is what's got to happen. Like, you cannot afford to not be on the schedule at any point in time. Yeah, I got it. Yeah, I got it. Yeah, I got it. You get the text message today, and he's like, yeah, I can't make it tomorrow. I'll let you know when I can come in. So we'll see. Hopefully when he comes in next, it's not because, hey, my right hip feels bad. You know what I mean? So again, I'm not going to sit there and beg and be like, but please come on to schedule because I need you to pay bills. No, you'll be in. It's just not going to be on terms that you want. And you might be ready to listen to me a little bit better next time.
When you discharge someone, essentially cleared out the problem, they're passing the test, you're happy that they're kind of good to go. Like, what is the conversation like in terms of when do I need to see you again? Is that a very does that vary across person to person, or do you kind of generally have something in mind that you like to suggest?
It varies amongst person to person. I mean, I'm always clear in saying that I want to find the visit frequency that is the absolute longest, right? The largest duration of time in between visits to where we can keep you under a symptom threshold. And it just depends on the person. Some people I'll slowly build out. I'll say, okay, I'll see you in 2 weeks. 2 weeks is fine. See you in 4 weeks. If 4 weeks is fine, I'll see you in 6 weeks. And we just try to build them out that way. Those are the people that I'm a little bit more worried about flare-ups happening consistently, right? People who use their shoulder, people who use their hip, people who use their back. You know, they're a construction worker and they've got back pain. And I'm like, you know, you're better off coming in a little bit more as we build you out than not. You know, the person that has foot pain and they're a guitarist, professional guitarist, I'm going to be like, catch you in 6 weeks, bro. See how 6 weeks goes. 6 weeks goes good. I may even consider going out to 12 week. It's a feel thing too. And you've got to look at you got to feel the tissue quality. You've got to feel how everything around it is going. You know, just because you remove the adhesion doesn't mean there's not hypertonicity in there. And if you can't get that hypertonicity to go away because there's a long-term disc injury, that shit's coming back, and it's coming back faster than anybody really wants it to. So it all just depends. I can't give you a cut and dry answer, unfortunately.
Yeah, no, I think that's good. It just gives a little bit of back information to people about what that thought process is. You know, when they get that suggestion, like, where are we going to see you on the schedule? And that's why, essentially.
Yeah. I don't want to see you, right? Like, let's be let's be utterly and perfectly clear about, you know, I don't, you know, if I like you and I like when you come into visits, I'd rather literally go get a Foster's with you, right? Throwing it to a little Australian beer there for all my Aussie.
We don't actually drink much.
Don't actually drink Foster's. Yeah. Fuck. All right. Well, I don't know. I'd rather take you out for a fucking Vegemite sandwich. Vegemite sandwich and an Australian football match. I'd rather do that. I don't want to see you in my office. I would. And if I don't like you, I I don't want to see you, period. Right? It's just me focused on figuring out what is best for your joint. So I don't get anything out of, I mean, obviously I get some, you know, professional benefits out of you continuing to come in, right? I get that visit every 6 weeks, that visit every 8 weeks, whatever it may be, which is, that's nice. At the end of the day, it's not going to make or break my fucking fiscal year, but I'm doing it because you need to, and that's all I care about.
So there it is, folks. That's our take on longevity care. You know, this just fits in. It actually leads on really well from where we got to last week, where we were talking about, you know, being pain-free at 100 and making decisions now to end up in the best shape possible down the road. This is part of that. And so we don't call this wellness care per se. We probably differentiate it a bit by just calling it longevity care, because that's exactly what it is. It's longevity of the joints. It's longevity of the tissues. It's longevity of the human body. So it's getting it to the best shape possible in the future. And, you know, we're aiming to be pain-free at 100. That's the point of this podcast, right?
Absolutely.
All right. Well, next week's episode 20. So, man, we're going to have to come out with a bang. Who knows? We'll have to have a think about this one. What are we going to do for episode 20?
Stay tuned.
All right, folks. We'll be back. We'll see you soon.